Hi, I'm Dr. Mitchell Roslin. I'm the chief of bariatric and metabolic surgery at Lenox Hill Hospital in New York City and Northern Westchester Hospital in Mount Kisco, New York, which is located in Westchester, and a professor of surgery at the Donald and Barbara and Donald Zucker School of Medicine at Hofstra, all part of Northwell Health. So one of, I think, the most interesting topics, and it's very difficult even for us to understand, is the impact of obesity on sexual function and on sexual hormones. Many young women have been diagnosed with a condition called PCOS or have irregular menstrual cycles. And what you'll find is that PCOS is very, very much linked to insulin resistance. What does insulin resistance mean? It means that when you challenge somebody with a sugary juice, they need to produce more insulin at first to regulate their glucose. And what does that high insulin level that stays elevated for a while? And this happens even before their glucose rises, which is why a lot of primary care doctors miss this because they think that high insulin means high glucose. And they measure your glucose and your hemoglobin A1C, but they don't measure your insulin level. But what insulin does at the level of the theca cells in the ovary is they promote estrogen being formed into testosterone, which starts the cycle of polycystic ovary syndrome. Similarly, men who are obese have excess fat tissue, and what they do peripherally is they convert their testosterone to a type of estrogen called estradiol. And that's what gives them a distribution where they have high hips and buttocks. That's more characteristic of called gynoid obesity, as opposed to android obesity, which is the man that you kind of see what other authors have referred to as the weak belly, what we used to commonly see called the bare belly or male pattern obesity. So the sexual hormones and their impact on obesity is really, really fascinating because obesity changes the hormonal distribution that you have, often different in different people. Additionally, many of the sex hormones abound in fat. So when you lose weight or your fat distribution changes, they change as well. How important? Well, look at what we see. When women are generally obese, not all, many of them have big hips and buttocks and heavier lower distribution. Men tend to have a more central distribution. Additionally, the central distribution is more correlated with diabetes and heart disease, and the peripheral distribution correlated with a lot of joint and extremity disease. Again, important point, healthy people are healthy. They have normal levels of their sex hormones. If men are having hypogonadism or young women are not menstruating regularly, there's a problem. And don't accept the doctor's answers that this is common. This is something that should be pursued. And again, the best medicines are medicines that will help result in weight loss. The role of exercise is absolutely essential, and healthy people have healthy sexual function. Thank you. I'm Dr. Mitchell Roslin, and if you enjoyed this video, please subscribe to our YouTube channel.